evening, everyone, and welcome to tonight's HRI Talk. My name's Becky, and I'm the Manager of Communications at HRI, or Homewood Research Institute. We're so glad to have you here with us tonight. For those of you who might be joining us for the first time, at HRI Talks, we are exploring research ideas and discoveries that are helping to power progress in mental health and addiction. These are free public events, and our aim is really to give some hope and shed some light on the importance of mental health research and on the far-reaching impacts that this work can have for our friends and our loved ones who are living with mental illness and addiction. Before we begin tonight, please note that closed captions have been turned on for this event. So if you'd like to see live subtitles or transcription as we go, you can enable those options with the closed caption button on your Zoom screen. Just to kind of ground ourselves and let you know that the offices in which we work at HRI are located on the traditional lands of the Anishinaabe, the Attawandaron, the Haudenosaunee, and the Métis peoples, and on the treaty lands of the Mississaugas of the Credit. At HRI, we acknowledge that our history as white settlers has caused a great deal of suffering and trauma for a great many people, and we do reflect upon the deep and lasting impact that these traumas can and will continue to have. We support the Truth and Reconciliation Commission of Canada's calls to action, and we are continually working to be more inclusive in our research practices and our everyday operational practices. We want to do our part to promote reconciliation and healing, and we would invite any input that you might have on how we can do better going forward. So for those of you who aren't familiar with HRI, we are a mental health charity, a national charity. We conduct applied research that really aims to advance mental health and addiction services in ways that can benefit more people sooner. So currently we focus in 4 key areas: trauma, addiction, digital innovations, and the evaluation of treatment services and outcomes. And we're really thrilled to be working with so many of North America's most influential scientists, trainees, and clinicians, such as our guest tonight, Dr. James Mckillop. Some housekeeping notes really quickly. We're going to have a 30-minute moderated conversation with our guest panelists tonight. And that's based largely on questions that you actually submitted in advance to us. And then at that time, we're going to shift over to live questions that are coming in. So we would love to hear from you. If you have questions, you can use that Q&A button on your Zoom panel anytime during the presentation. And we'll get through as many of those questions as possible before we wrap up at 8 o'clock. Really quickly, before we jump in, I would like to note that some of the content we'll discuss tonight might be a bit sensitive. It might be difficult for those of us whose lives have been directly impacted by mental illness, substance use, or addiction. So if at any time you feel like you might need some support, I would encourage you to visit wellnesstogether.ca. Here you can access mental health and substance use support at any time of the day or night. It's a free service. It's a great resource for Canadians. So if you do feel like you could use some help, check out Wellness Together Canada. And finally, before I hand the conversation over to our moderator, I would just like to extend our deepest gratitude to our sponsors for HRI Talks, KPMG, and Fusion Homes, as well as our feature sponsor for tonight's event, CIBC. These events would not be possible without their sponsorship, and we're very grateful. And if you would like to contribute, support future events, or make a donation to our ongoing research, check us out at hriresearch.com and get connected. So without further ado, I would like to introduce you to our moderator tonight, my esteemed colleague and HRI's Director of Evaluation, Dr. Jean Costello. Jean obtained her PhD from the School of Public Health and Health Systems at the University of Waterloo, where she's now an adjunct faculty member. And since 2014, she has led HRI's evaluation program, working closely with program administrators, clinicians, and researchers like our guest tonight, James Mckillop. So welcome, Jean Costello.
Great, thank you, Becky. And hello, everyone. Thanks for joining us this evening in what I hope you'll find to be a very stimulating and timely discussion with Dr. James Mckillop as we explore addiction and mental health in the context of the ongoing COVID-19 pandemic. I'd like to ask Dr. Mckillop to join me now if on screen as I briefly introduce them. Dr. McKillip is an HRI senior scientist and professor in the Department of Psychiatry and Behavioral Neurosciences at McMaster University. He is also the director of the Peter Boris Center for Addiction Research and director of the Michael Degroote Center for Medicinal Cannabis Research. James trained as a clinical psychologist at the State University of New York at Binghamton and Brown University. And much of his research applies behavioral economics and neuroeconomics to understand addiction, while also leveraging perspectives from complementary fields to generate unique insights into addiction. His recent work, which will be of discussion tonight, examines changes in alcohol and cannabis use during the pandemic. And earlier this year, James was awarded a Tier 1 Canada Research Chair in Translational Addiction Research, a very distinguished award. So with that, welcome, James, and thanks for joining us this evening.
Hi, Jean. It's great to be with you.
Great. Well, perhaps we'll just jump right into it. I wonder if you could speak generally about how COVID-19 has impacted mental health and substance use in Canada, and maybe highlight some of the responses from funders and researchers to address these emerging priorities.
Yeah, I'd be happy to. I think that almost from the onset of the pandemic, there's been a very clear recognition that its impacts would be profound and far-reaching, and that there was going to need to be a coordinated strategy for understanding those impacts. And I think that what's been really nice to see has been the evolution from a lot of sort of reflexive, anecdotal reports and responses to much more systematic research, much more evidence-based thinking, much more nuanced appreciation of the impacts of the pandemic. And I think that the reality is we're not in the post-COVID period yet. We're still very much within the pandemic, but I think that we are within a period in which there are data to look to, and really I think that that's essential to marshal the best resources in healthcare to address the issues that are arising.
Great. Yeah, and I wonder then if you can speak to maybe some of the specific responses from funders and researchers. Have there been any special calls or priority areas that have been sort of leading the way in terms of responses?
There have indeed. I think that it's been great to see the Canadian Institutes of Health Research create requests for applications to support research on mental health in the context of COVID. Health Canada also, and I think the academic community has really risen to the occasion and met the moment to the extent that at McMaster University, where I'm located, and really at all universities across Canada, it's clear that there have been resources created in order to accelerate faculty research on these kinds of topics. So I've been fortunate insofar as my own lab has been able to expand our scope in terms of research on COVID and substance use and also other forms of mental health. And I think that that's really been because the federal and provincial governments have stepped forward to say we're going to resource this accordingly.
Great, great. Well, as you know then, a major concern for many Canadians is the ongoing opioid crisis. And to address these crises, we really need to better understand them first, I think. So can you offer any new insights, perhaps from this work that has been underway towards any contributing factors that might help us better understand the opioid crisis in the context of the COVID pandemic particularly?
Absolutely. I think that this has been one of the most tragic stories of the pandemic. And stepping back for a moment, one can really think of the impact of the infectious disease pandemic as being a stress test for society in general, and often where there were vulnerabilities, those vulnerabilities are made all the more apparent by virtue of this stress test. And the reality is the opioid epidemic was an epidemic before COVID-19. This is a major problem that has been identified for close to a decade now, and really since 2016, there's been a sense that the trajectory was not getting any better. The number of overdose deaths each year were growing gradually higher. The number of overdoses and rescues that had to happen was ever growing larger. And unfortunately, the contamination of the contraband drug supply with highly toxic compounds like fentanyl was getting ever more common. And all of this is the context prior to the pandemic. So unfortunately, it's hard to be surprised by what's happened, but the reality is really chilling, because what we've seen is that the opioid overdose deaths have really increased dramatically by about 70% since the onset of the pandemic. What that looks like is around 3,600 in 2019, and then in 2020, nearly 6,500 Canadians lost to opioid overdose. That's an enormous number, and really a tragic consequence of the pandemic. And what do we trace this to? Well, it reveals where these risks are. Part of the big challenge has been that isolation has precipitated in some people lapses and relapse, and even worse, isolation in combination with using opioids can be a really tragic intersection of factors in which, if an overdose happens, there's no one there to administer naloxone or to call paramedics. And what starts as a potentially preventable overdose, unfortunately, proceeds to death. So I think that part of what we see is that although public health guidelines and restrictions have been remarkably successful in controlling the burden of the infectious disease pandemic to the extent possible, a reality is some of those restrictions have meant that there has been more isolated opioid use, and that has contributed to the increase in deaths. And then, of course, the other consideration is this continued proliferation of toxic compounds in the illicit drug supply. Fentanyl is implicated in nearly 90% of the overdose deaths that have happened in the last year. And so really, in some ways, this is an overdose epidemic, but it can be almost thought of as simply a fentanyl overdose epidemic, not opioids in general. And I think that this captures just how challenging the situation is, because we're dealing with compounds that are simply much more toxic than the opioids of previous periods. And the reality is, unfortunately, opioid drugs are extremely potent, and at high levels can lead to respiratory depression and death. So those are the factors that are really, unfortunately, exacerbated either by the pandemic or over the course of the pandemic.
Right. So I wonder about disruptions to services too, or barriers to access. Do you think those would have, as a result of the pandemic and some of the regulations that were in place and restrictions, also contributed to this in some degree?
I certainly think so. I mean, what we see in the data is a spike in overdose deaths that has then become the new normal, unfortunately. Basically, every 4 months, it used to be between 700 and 900 deaths per quarter, and that's now gone up to around 1,500, 1,600, 1,700. It hasn't continued to rise. I think part of it is that, unfortunately, the disruptions in access to services meant that many people have become somewhat disenfranchised from the treatment community or from mutual support organizations like Alcoholics Anonymous, in this case, Narcotics Anonymous. And I think that although there is a return to normalcy of sorts, those healthcare disruptions have definitely been part of the tragic increase that we've seen.
Right. So a lot of contributing and intersecting factors there, I think, that you've outlined. Well, we know that, kind of switching gears, we know that alcohol use, though, is quite common among many Canadians. But what evidence do we have that of how the COVID pandemic may have impacted alcohol use among Canadians?
It's a great question. And I think that it's an interesting question because it's at the other end of the spectrum. The overdose crisis among opioid use disorder, individuals with opioid use disorders is a tragedy, but the reality is it pertains to a relatively small segment of the population. In terms of overall prevalence, the rate of opioid use disorder is quite low. At the other end of the spectrum, the majority of Canadians drink, and the prevalence of alcohol use disorder or high levels of alcohol use is very high at a population level. So right from the start of the pandemic, there was a lot of concern that this is where there could be major exacerbations in unhealthy drinking or relapse, for example, among individuals with alcohol use disorder. Mm-hmm. The good news seems to be, and this is still obviously not definitive settled science, but a lot of the large-scale population surveys suggest that although some people report increasing their drinking, typically around 1 in 5 individuals, depending on the survey that you look at, about the same number actually report decreasing their drinking. So most people don't report large changes in their drinking. And although there is some change in behavior, it seems to be that there's as much going up as there is going down, which of course is very coarse, but does not suggest that it is as a dramatic increase that would perhaps be a huge red flag. The other thing that we know is that alcohol retail sales haven't changed dramatically. And this is from a study that you and I collaborated on together, looking at alcohol retail sales from 16 months before the pandemic to 16 months during the pandemic. And to be sure, you can see a spike where people stockpiled alcohol right at the beginning of the pandemic. But after that, it's a relatively flat line, slightly higher than usual, but not dramatically increased. And overall, about 5.5% higher than we predicted in our models. So that suggests that drinking or alcohol consumption may be up, but at least we're not seeing dramatic changes. And in my own data, looking longitudinally, what's been interesting to see is that actually in some of our heaviest drinkers, we've seen the most dramatic decreases in drinking over the course of the pandemic, which has been interesting also. So although not definitive at this point, it seems like the changes in drinking have not been necessarily as dramatic as perhaps we were concerned about at the outset of the pandemic.
Great. Well, I think that's reassuring news in some cases. What do we know about cannabis use? We know that's also quite prevalent, maybe not as prevalent as alcohol use among Canadians, but any insights of how the pandemic may have impacted cannabis use among Canadians?
Great question, and you're absolutely right. After alcohol, cannabis is, by some measures, the most common other psychoactive substance used by Canadians, close to tobacco at least. And what we see there is a bit more worrying than alcohol. If you look at these same sorts of large-scale surveys, in some cases we see 50% or slightly higher of people who use cannabis reporting that they've increased their cannabis use. In other cases, we see that it's more like a third report increasing, but a much smaller proportion reporting any kind of a decrease. So unlike that kind of parallel numbers of individuals increasing and decreasing when it came to drinking, it seems like the balance of change, at least as self-reported by individuals using cannabis, is in the direction of increasing use. So that's a bit more troubling. And in our study looking at retail sales, we did see a similar pattern In that case, again, looking at 16 months prior to the pandemic to 16 months during the pandemic, we saw that there was about a 24% increase in cannabis sales above and beyond what we predicted. And that's a pretty large amount. When we actually did the math and figured out the number of dollars, that was more than $800 million worth of cannabis sold beyond what we predicted. Not overall, but just extra sales, excess retail sales. So it does seem like cannabis use is increasing, perhaps due to the pandemic. The other reality is that this has happened to overlap with the continued rollout of legal cannabis. And I personally have noticed that a lot of the storefronts around where I live advertised home delivery of cannabis. And the reality is it may very well have been that people took advantage of access via the Ontario Cannabis Store or storefronts, and that may have contributed to a certain extent. Or it may also be the case that the retail sales are up somewhat because people have moved away from buying illegal cannabis and moved to legal storefronts. So a complicated question, but I do think that a number of pieces of data suggest that the pandemic appears to be associated with increasing levels of cannabis use, certainly more evidence in that direction than for alcohol.
Interesting. And have you seen anything around, different subgroups? I'm thinking youth or young adults specifically, whether it related to alcohol use or cannabis use? I know there's been some attention to, especially to the impact of the pandemic on young adults and youth.
Absolutely. Well, I think that one of the subgroups that so many people were concerned about at the outset of the pandemic were young adults, especially when it came to substance use. And so we've done a number of studies, as have other groups. And what's been really interesting is that actually these groups seem to be showing more notable decreases in substance use. And that at first was quite surprising to us. What seems to be the case, and as often is the case in research, when you start thinking about your results more deeply, they make more sense. The reality is a lot of young adult substance use takes place in congregate settings like bars and music performances or festivals, at parties, all the things that would not be available during public health restrictions, during stay-at-home orders. So in many ways, a lot of the environments in which a lot of youth substance use takes place were removed by the pandemic. And these studies focusing on the early stage of the pandemic do suggest that there was commensurate decreasing alcohol use, at least. Now, that doesn't suggest that a good prevention strategy for alcohol misuse is an infectious disease pandemic. That's clearly, that would not make any sense at all. And it's kind of a glib way to think about it. What it suggests is that it's a complicated relationship and that it's not as simple as the pandemic will precipitate increases, but that the pandemic disrupts across society and that we will see differential increases and decreases in ways that make sense according to those disruptions. And I think that the story among youth really illustrates that. And one of the other concerns is, will there be a rebound? Because after months of being unable to engage in a lot of the things that make young adulthood fun in terms of recreating with friends, going to sports events or other events, will there be a rebound with abandon because of the kind of prohibitions of the public health guidelines? So I think that the window is expanding in terms of making sure that we pay attention to changes over time, because the early stage is probably not going to be representative of the entire duration of the pandemic.
Right. There's potential for longer term impact, I think, and we certainly want to monitor that. Any other reflections or insights that you can share with us related to any work on COVID and mental health and addictions that you might have been involved in or colleagues have been involved in?
Well, I think that, what has been a kind of remarkable opportunity has been that because in many cases in my lab, we were collecting data prior to the pandemic. The pandemic then created a chance to understand our cohorts using new measures and to understand the Canadian experience in particular, because compared to a lot of other countries, the morbidity and mortality in Canada has been considerably lower. It's about 3 times lower than the United States. It's about 2.5 times lower than the United Kingdom in terms of just raw, unfortunate numbers of deaths per capita per 100,000. And so it has been fascinating to monitor, along with substance use and mental health, how people have changed in terms of their adherence to masking, to physical distancing, to following public health guidelines. And we've also monitored how people respond to government recommendations and their perceptions of government. And we've also seen, data signatures of pandemic fatigue. People over time really describing their distress at the duration of the pandemic and their frustration with some of the government strategies. And I think that it has been a window into not just the substance use and mental health issues in our data sets, but also the whole experience of the pandemic more broadly also.
Interesting. So it sounds like you've been able to really adapt some of your ongoing studies to really unpack the experience of COVID and the experience of individuals within dealing within the changing legislation and the changing rules around masking and stuff to really understand that. And I think that's great and it sounds like a very efficient way to study these things too, by taking advantage of some of these longer term cohort studies that you have going on. So that's great. I'm wondering about any examples that you can pull from where you might be able to offer some insights into hope. So are there stories of resilience that reveal themselves in this work or in other work that you've come across, something that can leave us with a sense of hope from this talk?
Absolutely. I think one of the cohorts that we've been following is a group of individuals who all had alcohol use disorder and were making a significant recovery attempt. And we were originally we started the study to understand the mechanisms that are responsible for successfully being able to change your alcohol use. And within this group, during the pandemic, we reached out to find out how people were doing in terms of their substance use, their mental health, and also did, in addition to the usual quantitative questionnaires, we did qualitative interviews to find out about their experiences and any recommendations they had for how virtual resources could be improved. And one of the things that was very interesting was we were unfortunately not very optimistic because we felt like this was a group that would be likely to, unfortunately, be nudged towards relapse by virtue of the pandemic. But we really didn't see that in our data. We did see a lot of people were reporting distress and disruption, but we did not see dramatic increases in drinking. And a lot of people, a surprising number of people, were able to find silver linings and report some positive consequences of the pandemic, and to really report instances of adaptive coping, highly resilient behavior. And so I think that the assumption that people with substance use disorders would necessarily be pushed towards relapse was really undermined by our data in a very positive way. And we also saw in the qualitative interviews, it looks like my screen may have frozen, but hopefully my voice can still be heard.
We can still.
Great. Sorry about that. What we also heard in those qualitative interviews were some of the benefits of the virtual treatment community, that people felt like they could go to mutual support meetings any time of the day. They could go multiple times a day. Not everyone said that they liked Zoom AA meetings, but a substantial subgroup did say that they liked them and benefited from them. And another group, well, other reports were that some of the public health restrictions made them feel like they were kind of able to have training wheels or live in a dry society. And so many of the things that people didn't like about the public health restrictions actually wound up being beneficial, which was sort of a story, another silver lining, if you will, of the pandemic.
Right. Oh, that's really interesting. I'm wondering too about, we hear a lot about transitions to virtual care and telehealth. And I'm wondering, you mentioned, online meetings. And so, is that a possible silver lining too of being, in a sense, having the treatment system have to pivot so quickly into providing virtual and telehealth services?
I think so. And I'm sorry, my camera seems to have now terminally stopped working, which is unfortunate. But I do think that has been a benefit. I think that the pandemic really made the healthcare system, it forced the healthcare system to adapt in a way that would have been glacial otherwise. And what could have taken years, if not longer, to take root now has had to come to life. And I think it could certainly be improved and expand further. But I think that what we appreciate now is that the treatment of substance use disorders really needs to be versatile and adaptive and take place in traditional settings like clinics and residential programs, but also take place in virtual settings like Zoom rooms and message boards and other electronic media that can support recovery, because recovery is a complex thing. It's not just as simple as not drinking or not using a substance. It's a lot of things, and it requires there is no silver bullet. You really need to have a lot of different tools to address recovery. Yeah,
and I guess there's might be obvious to say, but there's no one size fits all, I think, for what works for one individual may not work for others.
That's absolutely right.
Well, wonderful. I think we've really covered a lot of ground in this first part of our discussion, all the way from how COVID has impacted individual substance use and mental health, and how treatment systems and providers have responded to address these emerging priorities and opportunities in some cases. I think most importantly, what I'm struck by is the stories of hope and resilience. And I think these are really inspiring messages, which I hope we can continue to learn from as we look for effective solutions to address issues of substance use and mental health in the future. And at this time, I'd like to remind the audience perhaps to enter any questions they may have into the Q&A section at the bottom of your screen. And I'll welcome back Becky to bring forward any of these questions from the audience.
Thanks, Jean. Thanks, James. This is great so far. We are getting some questions. And if you've attended these events before, I kind of stream the questions where we're getting multiples of the same question. I'm going to bring those forward first. So I am seeing some themes here. I'm going to kind of combine two questions that came in. They're similar. What kinds of things should we consider at a society or system level to mitigate negative impacts of the pandemic? And is there an increased need to focus on mental health promotion in Canada in specific areas more upstream?
I think that's a great question. And I think that what we have learned from the pandemic is that we do need more systemic supports in terms of resources. And I think that the reality is that the substance use disorder treatment community was struggling before the pandemic, and that's part of the reality of the opioid overdose crisis, and that really it is an area that needs substantially more resources to address to offset some of these really tragic consequences of the pandemic. And not only for the most severely affected, but also in the general public and in the general population, where we are seeing notable increases also in my data.
Excellent. Thanks, James. So you mentioned differing impacts across different populations or subgroups. Have Indigenous and other marginalized groups seen more detrimental impacts than the population at large?
Another excellent question. You know, I wish I could say I knew for sure. I think that unfortunately, most of the studies that have been done to date, including my own, have had underrepresentation of Indigenous or other racial or ethnic minority subgroups. And I think that the reality is we would expect the harms to be more significant. It's well established that there are health disparities. And unfortunately, it's very hard for me to believe that the pandemic would not exacerbate those health disparities, because it really is among individuals who are most vulnerable where the greatest burden has fallen. And so I can't point to articles or studies that demonstrate this definitively, but I would be very surprised if where we are detecting adverse consequences of COVID-19 in terms of substance use and mental health, those effects are not worse or larger in magnitude in Indigenous populations or other racial minorities, unfortunately.
Thanks, James. I got an interesting question about language. You mentioned and used the term toxic. This is in regard to the opioid conversation. Do you think it's more appropriate to say toxic poisoning deaths versus overdose deaths to get closer to the truth of what's happening?
I think that's an interesting point. I think that certainly language matters a great deal in this area. And I think that part of the issue is that the language we use is very much part of how stigma is perpetuated around individuals with substance use disorders. And I think that some would argue that referring to these deaths as overdoses are part of that stigma. I struggle with it a little bit because I think that it is typically poisoning someone implies a different relationship, but it's something that I think bears consideration, because I think that we have to be careful about how we frame behavior in order to maximally undermine stigma against people with substance use disorders.
Thank you. Another question, are we seeing similar trends in other parts of the world?
Well, I think what's interesting is that there are kind of patterns of trends that are similar, and then there are exceptions to the rule. So, for example, early in the pandemic, very similar patterns of decreased alcohol use were seen in a number of countries across Europe, although with notable exceptions, the United Kingdom and the Republic of Ireland being two. So I think that at a population level, in some cases we see similarities, in other cases we see some differences. Certainly, the burden of the COVID-19 pandemic from a disease standpoint and from a substance use standpoint seems to have been higher in the US relative to Canada. That's a natural comparator. The opioid poisonings have been even higher still at a per capita rate. Now it has been documented that the first year has passed with more than 100,000 individuals dying of opioid overdose in the US. So that is worse still. And it does appear that a recent study came out in JAMA suggesting that alcohol-related deaths are substantially up in the United States over the COVID-19 period. So I think that the Canadian experience is in some ways specific to Canada. It does not necessarily parallel all other trends. Some of the larger trends are common, but there are some exceptions also. And I think that that's why it's important to kind of make sure that we both look more broadly, but focus on the Canadian experience, which has been not unique, but has specific features based on the federal and provincial responses.
Thank you, James. Just reading through the questions as they're coming in here quite quickly. I think this is one that's going to come up a few times. Do you have any thoughts on how we can best support youth as we start to open up to reduce potential harm as substance use in congregate settings begins to increase again?
I think that's a great question. And I think that what is so important to me about beginning to remediate the challenges of the pandemic is not just programming against substance use in youth, but thinking about how to foster restoration of meeting those developmental milestones that were disrupted. Because when we think about young adults, especially individuals 18 to 25 or even 18 to 30, these are individuals who are going through a crucial formative period of their life in which they're typically leaving the home, they're finishing their education, they're often starting their first serious relationships, getting married, in some cases having children. And there has just been an enormous amount of psychosocial disruption across these different domains. And I think that promoting resources for generally healthy lifestyles in youth are as important as prevention programs against alcohol and other substance use, because those alternative reinforcers are critical counterweights to using psychoactive drugs and ultimately developing substance use disorders.
Great, thank you. I'm going to pop down to this question. With regard to harm reduction, services and supports for those whom have struggled with mental health and or alcohol use disorder, substance use disorder during this time and moving into the future, what do you think can be used to mitigate this crisis beyond what is currently being used, using the data obtained so far?
Well, I think that the reason I'm quite passionate about harm reduction is that it's so critical because it prevents irrevocable consequences, including things like death, in order that people may ultimately achieve long-term goals or even simply sustain lower harm from substance use. And I think that the risks of substance use during the pandemic really highlight the need for access to these kinds of harm reduction resources that permit people to, not find themselves in free fall and not be unnecessarily harmed by substance use. So I think that it has really, the pandemic has been an opportunity to recognize how important those resources are in managing substance use. I do apologize that my webcam seems to be completely defunct at this point. I apologize.
No problem. We can hear you just fine. You touched on this briefly. I have a question about the impacts to adult mental health as well.
Yeah, I think that what we've seen is that certainly there have been lots of reports of exacerbations in terms of adult mental health. I think that most people have experienced a lot of stress, and the reality is nearly 40,000 Canadians have died from COVID-19. So in a very real way, and that understates all the people who have had severe infectious disease. So we know that there have been major deleterious consequences that obviously have immediate mental health impacts on individuals. I think that what's really unclear still is who is suffering the most and where do the resources need to go? Because in some ways, I will say that in my own data, we have been surprised by how resilient people who were quite severely unwell in terms of mental health prior to the pandemic have been. And in a similar way to the kind of dry society that I alluded to before, it seems like some of the public health restrictions have actually provided some protection for individuals who were highly anxious, for example, or were often struggling with being in public settings. So I think that what I see in my own data is a need to better understand what the risk factors are and how to help the healthcare system adapt to identifying people who are having these negative consequences and meet their needs. And I think that that's where it's much less simple than we originally thought. And I think that it's going to really take a coordinated effort in primary care, as well as in specialist care, to identify people in need.
So kind of in the same vein, James, are there any new or additional mental health and addiction services that might be needed as we move forward and try to move on from the damage caused by the pandemic?
I think this is where the virtual resources have really an opportunity to become permanent fixtures in the treatment landscape. I think that they are not a one-size-fits-all solution. And I think that they won't fit everyone's needs by a long shot, nor should we expect them to be as effective necessarily as more intensive treatments. But I think that what's increasingly clear is we need a network of services, and that's not just medications or residential treatment, but it is access to psychological treatment via telemedicine. It's access to mutual support groups. It's access, essentially a no wrong door approach when it comes to treating substance use disorders, in which people can find care if they're struggling without necessarily having to go through the traditional healthcare and mental health care systems.
I wondered if I could add a question onto that, just Becky, around digital mental health services and the role they play in that continuum of care. James, if you could speak maybe a little bit to that, on opportunities there or evidence that may have emerged around digital mental health services. So I'm thinking like apps or online platforms, that kind of stuff.
Yeah, well, I think that there's enormous enthusiasm, and this predates the pandemic. There's enormous enthusiasm about the prospect of digital mental health services, and people are using digital health throughout the healthcare landscape for diabetes management, for weight loss, for any number of things. I think that this has been a kind of live pilot of a lot of those offerings, and my sense of the evidence base is that it is growing and generally favorable. But, and this is kind of a big but, I think that what we know from the evidence is that there's a lot of heterogeneity, which means basically, depending on the service, some seem to do better than others. And there's almost certainly a certain amount of variability in response, and we don't know a lot about which work best and for whom. I also think that the other big but is what could be a mistake of thinking that these digital platforms can replace the more robust traditional platforms because they're more cost efficient or because they're more accessible. The reality is, I'm a clinical psychologist by background, and I do think that a lot of the in-person and dedicated one-on-one care still is often the most potent medicine you can find, pound for pound, and that an app may be helpful, but it shouldn't be viewed as the replacement for our traditional healthcare system. I think if it's viewed as being part of a complementary portfolio network of different ways people can find support, then to me, that would be a very positive thing. And I think that the evidence points us in that direction. But as a replacement, I would be extremely skeptical.
Thank you, James. What are your thoughts about safe drug supply?
What a great question. So for those of you who are not familiar with safe supply, this is a harm reduction strategy in which physicians prescribe opioids for ongoing use in order to prevent patients from consuming contaminated illicit opioids. And it's very controversial, in part because there's a very small, there's very limited evidence, and there are considerable concerns about potential diversion because the opioids that are prescribed are high potency drugs that themselves could be sold or used or could result in overdose. And there aren't a lot of parallels elsewhere in substance use disorder treatment. There are protocols like the use of opioids under controlled conditions. There are managed alcohol programs, but this is a slightly different version of that kind of harm reduction strategy. I know a number of physicians who are using safe supply in their treatment practice, and I think that these are decisions made because people's lives are in danger, and there's a sincere belief that this is a strategy that could save lives. As an academic psychologist, I tend to be a bit wary of practices until there's some level of evidence that demonstrates that the benefits outweigh the harms, and to a large extent that isn't present yet for safe supply. I will say this, I sometimes think this is a very controversial topic, and there's a lot of discussion about it. I sometimes think that it is a bit of a red herring insofar as the amount of discussion that happens, because there are a lot of evidence-based practices that are not available for treating opioid use disorder and could be argued should be made available before strategies like safe supply. So intensive case management, housing support, contingency management, community reinforcement strategies. A lot of the evidence-based strategies that exist out there are not readily available. And so safe supply may be viable. I think that hopefully we will have evidence that speaks to that sooner or later. But fundamentally, it's a way of reducing overdose death. It is not necessarily, as a precondition for people to successfully recover, it's not necessarily going to be the path to recovery per se. And those evidence-based strategies, I think, are getting, unfortunately, much less discussion when they are resources that really are needed now.
Thanks, James. That's about 5 to 8. If we didn't get to your questions tonight, I know there's still a few in the queue here that we didn't get to. If you want to connect with us, James has offered to answer some questions by email after the event. So if you'd like to, you can check in at hriresearch.com. You can find all of our contact detail there, our email address. And if you want to drop us a line, we can share your any outstanding questions with James.
Great, wonderful. And James, do you have any web resources that you could refer the audience to? Maybe that's something we can also promote if there's anything that comes to mind.
Absolutely. Yeah, we do have a COVID-19 research hub on the Peterborough Center for Addictions Research website. That's where we post publications and preprints. And then if there are other articles that are from outside the center that we think are important resources, we put those up too. And then the other potential resource is we have our upcoming annual Cannabis conference in a couple of months, and we'll be doing a special module on cannabis and COVID-19 and how to understand changes in use and a lot of the dialogue that's happening around cannabis in the context of the pandemic.
Great. Okay, well, we'll be sure to post those and share those with the audience members as well. So wonderful. Thank you for all those great questions from our audience. And thank you, James, for such an informative and thought-provoking talk and discussion here. And I hope everyone who is tuned in has really enjoyed this conversation as much as I have tonight, and that maybe you learned something new and meaningful about the various ways COVID has impacted substance use and mental health here in Canada. It's been a pleasure moderating this session tonight with you all. And Becky, I'll just turn it over to you to wrap up a few items.
Sure thing. Thank you so much, Jean. And thank you, James, for taking the time to join us tonight. This was another very insightful, informative evening. Thank you so much to our audience. Thanks to those who stuck around to the end. And thank you for your great questions and your keen interest in this important work. We are going to share a recording of this video to our YouTube channel in the coming days, and I'll be sure to include any links that we've mentioned. I'll add those in the YouTube details, as well as a follow-up email that you'll get from us with a link to that recording. And so please feel free to share that out with others who might be interested. And we're also going to share a brief survey with you. If you don't mind just taking 2 to 3 minutes just to give us some feedback and comments. We've received great feedback so far, and every time we do these talks, we're making little adjustments to try and make them better and of higher value to you. For those who do share your feedback, we will enter your name in a draw for a gift certificate as our way of thanking you for your time. So we do appreciate that. Our next HRI Talk will be a few months from now. We don't have a date yet, but if you'd like to keep up to speed on that, please follow us on our social media channels. You can hop over to hriresearch.com where we post all of our news and events, and you can also sign up to be on our email list if you want that delivered right to your inbox. So again, I would really like to thank tonight's feature sponsors, CIBC, and our other HRI Talk sponsors, KPMG and Fusion Homes. We are really grateful to our sponsors and to everyone who supports HRI by attending these events, by donating, by following us online, or just by helping to spread the word about mental health and addiction research across Canada. So thank you everyone for being a part of tonight's event. We'll look forward to seeing you next time. Good night, everyone.